Thank you so much for the opportunity to be with you all here this morning on this beautiful Tuesday morning on December 7th. I know we're marking the 80th anniversary of the remembrance of Pearl Harbor, so we all have that in our hearts and our minds here today as well. My name is Representative Adam Niemerg, Niemerg. Again, it's Representative Adam Niemerg, Niemerg. I represent all part of 9 counties in southeast Illinois, and I'm out of Teutopolis as a Republican. The world has been ravaged by COVID-19. And what we're dealing with when it comes to COVID-19 is fear of the unknown. If we get it, are we going to be one of the folks that have a mild case, or are we going to be hospitalized? It is understandable that our leaders would want to fight this with every tool in their arsenal. But public health should not be an excuse to take away our freedoms and liberties. We should take steps to promote public health, but we must do so in the context of our rights as Americans. The Freedom Act, House Bill 4239, makes it unlawful for any person, public or private institution, or public official to discriminate against any person in any manner because of such person's refusal to obtain, receive, or accept COVID-19 vaccination contrary to his or her beliefs. This legislation also prohibits a public official, guardian, agency, institution, or entity to discriminate based on vaccination status, and the measure allows an individual to file a lawsuit in the event their religious rights are violated. The sad reality we are facing in our state and our nation is that our leaders are using the pandemic as an excuse to strip away Americans of their rights. We can't allow this abuse of power to continue. The rights guaranteed to us in the Constitution are not conditional. They are innate. I wish that House Bill 4239 were not necessary. I wish that our state's leaders would respect the rights of our citizens, but sadly, that is not the case. My legislation is necessary and is essential for the preservation of our right of conscience. For nurses and the healthcare profession who have been on the front lines of this pandemic for the last 2 years, not to have to make a choice between being vaccinated or putting food on the table. When the ban on the right of conscience legislation was being debated, more than 50,000 people signed witness slips in opposition to the bill. The people do not support what is happening to them, and they are frustrated to see their rights and liberties taken away. They want leaders to stand for them. Again, COVID-19 is serious, and it should be taken seriously. But we must not allow our rights and liberties to be taken away from us just because there is a public health crisis. I know this legislation is a long shot, given the political realities in Springfield. This is why I need help of concerned citizens to put pressure on the leaders in the House and the Senate to do the right thing by passing the Freedom Act. We need every single patriot in Illinois to make phone calls to their legislators to help me get this legislation passed. Folks, this is not about being pro-vax or being anti-vax. This is about the opportunity to sit down with your doctor, your healthcare professional, your families, and have that discussion and decide if the vaccine is right for you. If this vaccine were completely optional, I do believe vaccination rates would increase. But as Americans, we are speculative of an ever-growing government and these encompassing mandates, and rightfully so. You know, people talk about this slippery slope. Well, the slippery slope is right now, and it's here upon us. We need every patriot to get involved to help 4239 over the finish line. Thank you, and God bless. I'll take any questions if anybody has any.
Now, wait a minute. I thought Tom DeVore said the morning after that bill passed that nothing actually changed in the law and that you still have your right to conscience.
So the Healthcare Right of Conscience Act, they needed the supermajority to get it changed during veto session. It'll be effective in June. Well, my worry really is we'll come back here in a couple of weeks and they will not need the supermajority, and that legislation will be amended with a simple majority, making it effective immediately.
But his issue wasn't with the supermajority, June, January, it was the language of the bill. He went on Facebook and told all those 50,000 people who signed a witness slip, don't worry, nothing actually changed in the law, because they said right there, this doesn't change the intent of the original healthcare.
And that could be stipulated in a court of law, but what this does is it puts it completely in statute without argument. Because the argument on the House floor with the amendment to the Right of Conscience Act was explained that if this passes, which it did at that particular point in time, that the federal religious exemption form would be applicable to religious exemptions when it comes to COVID-19 vaccination mandates. We also what happened with OSHA. We've seen what's happening with the litigation pending from the Biden administration. But if you look at the federal Healthcare Right of Conscience Act, which you could file for that religious exemption, under Title VII, there is, on the last couple of paragraphs, there's a couple of sentences in there that could be open interpretation as far as an employer's undue hardship on their particular business operation. What this bill does is it takes all of that ambiguity out of those arguments and completes it in statute. So you have that option as a citizen of this state of Illinois to say, I do want to be vaccinated or I do not want to be vaccinated. And this limits the discrimination in the workplace from that occurring.
Now, you mentioned that people should have the opportunity to talk to their doctor if they want to learn more about it. Don't you think people are doing that already? The vast majority of Illinoisans are already vaccinated.
If they decide to do that, have that conversation with their doctor, and at the end of the day, they're talking with their families, and if they decide to be vaccinated, that's absolutely fine. And if they decide that it is not correct for them, if they decide that it is not something that they want to do based on their right of conscience, their beliefs, or their beliefs in the healthcare professional or their doctor, they should have that option as well. This is basically just about freedom of choice when it comes to vaccination mandates.
Shouldn't everybody else that's going to work also have the option to know that they're not going to be infected by someone who is carrying a deadly disease?
Well, shouldn't everybody that has the right to go to work understand that they're not going to be discriminated upon as a condition of employment? That's the real underlying issue that we have here. That if I go into a business and they say, is it a condition of employment for you to continue the operations here, or whether or not you're going to be hired here, you must be vaccinated. And I have these nurses. This came to being from many nurses that have called me over the last 2 months, and their concern is this. Adam, we have a situation where we've been on the front lines for the last 2 years of this horrible pandemic. We have had COVID-19. A vast majority of us have antibodies. We're not talking about breakthrough cases. We're not talking about antibodies when it comes to fighting COVID-19. We're getting tested weekly. We don't mind the testing. But now as a condition of employment, we're being said you must be vaccinated by a particular date. Otherwise, you will be terminated. This opens that up. This says that they can have that ability to say no to their employer against this discriminatory action.
Why would a legislature that just passed with supermajorities a bill that does the exact opposite of what they're trying to do? Why would you said this is a long shot? Well, yeah, why would they pass your bill?
I would certainly hope that they could look at it as a form of discrimination in the workplace, and it could be a bipartisan piece of legislation that could move forward.
Do you even think you'll get it heard in committee?
I certainly hope so, and I will be working it so it can be.
Isn't this really more about you? I mean, you've already laid out how long a shot this is, passing with supermajorities of Democrats. Isn't this really more about you trying to score points with people who don't want to take the vaccine?
Absolutely not. This is about freedom in the United States of America and freedom in this state of Illinois. This has nothing to do with my political agenda or my future as a state representative. This has everything to do with the rights of our citizens.
Now, I'm sure that you heard yesterday a proposal that was brought forward by Representative Jonathan Carroll. What were your thoughts on his proposal?
I completely disagree with that proposal. To sit here and to say that you will not be provided health care coverage from a private insurance company based on your vaccination status is completely discriminatory.
Well, why not? Aren't you the party of individual responsibility? Don't choices that you make affect outcomes that, I mean, isn't that consistent with arguments you've made in other arenas?
Well, I find it completely hypocritical from the Democratic Party that they talk about not covering an individual under a group health care coverage whenever we continually have unfunded mandates coming down from the state of Illinois, and we continually have other mandates that are put on health care facilities and insurance companies. But yet when we're talking about an all-encompassing vaccine, we're not even having conversations about other ideas when it comes to mitigation standards. You look at other states that are doing things differently. You look at other countries that are doing things differently. Yet in the state of Illinois, it's all about vaccination status. It's all about pushing a vaccine. And that is unacceptable. We need to have that opportunity to talk to our doctors, to talk to our families, and make that decision ourselves, not through government edict.
You talk about unfunded mandates. The rest of us who are vaccinated are going to have to pay higher health insurance premiums because unvaccinated people are going to the hospital, staying there 3 times as long, and racking up massive medical bills. Why should I pay for that?
Well, I would answer this. There are many cases that are coming through, breakthrough cases. These nurses that have been calling me, these nurses that have been calling me continually say, more often than not, it's a breakthrough case. So you have those costs associated with that as well.
There's still the
There
vast minority.
there are many breakthrough cases, and all we're talking about is vaccination status. That's all we're having discussions over. I am ready to have a discussion across the gamut of COVID-19 mitigation standards, and we should not discriminate any American because of their vaccination status, period. Any other questions? Thank you all for being with us here today.
You
Yes.
talked about other states and what you're seeing them do. Do any other states have legislation like this that was enacted?
Many states don't need it. Many states are Republican-controlled. Many states have the opportunity for their folks to make the decision on their own. And yes, there are other states that are working on this particular type of legislation and are pushing it forward. So thank you very much for the opportunity to be here. Have a wonderful day.